There's one there. Great. Okay, so we got a great understanding and view of blockchain. What in your experience or what in your daily work excites you the most? Give me one example of what excites you. Either it's a story, a startup, or an idea that excites you the most. Anybody can start.
Well, I'll go ahead and start. I think, I've been passionate about blockchain for quite a while. So I wake up living and breathing blockchain at this point. What excites me is knowing that there's a future that exists in blockchain and that you can create something writing one line of code and bring something to life out of that. And so just knowing that you can create something from scratch and solve a problem on a grand scale and see it in effect is something that is truly exciting for me. So I'm driven by the act of being able to truly help those that need blockchain, especially in third world countries. It's very applicable. And even here in the United States, I find it to be a passion, and I live and breathe it somehow. And so all of the different areas that I'm in have collectively come together with this one little area, and that truly excites me every day.
Thank you.
Is this on? Yeah. So what really excites me about blockchain is the dollar is such a narrow medium of values. It is so hard to get things done with it. But there are examples now. For instance, John Haynes from Mercy Corps in Portland put together this project where there's a piece of property that was in disrepair and receivership. It's in this community with individuals who are mostly all have never owned any property, but he, with heroic effort, created these financial instruments where the community, for $10 a month, could own this property. It made such a difference. The example of one of the fathers was he would smoke $10 less a month so that his daughter wanted him to be an owner for $10 a month. What you found was this community, all of a sudden, people are using their idle time thinking about what they can do with the property. They're self-organizing work parties on the weekends to depave the property. They're not littering on the property anymore. They're picking up litter. And you could see how a tokenized model could totally make something like that completely portable from community to community to community, where you could easily create the financial instruments and the tokens to track the amount of hours you put in on Saturday, the fact that Joe is planting the seeds that we're going to use for the garden, etc. It allows us this amazing flexibility because at the end of the day, the property's still there, the people are still there, but now, because of this ability to follow the value and create value, everything's different. People sit tall, they speak louder, they join in ways in which they wouldn't have done previously. So I think these types of stories are good examples of how you can use a token economy to unleash the real power that's inside of communities. And we're seeing that with smart city efforts, moving away from land value to community value. And this is a perfect example for blockchain.
Thank you.
So I'll offer a viewpoint. I guess I'll speak from a technology standpoint. I think one of the reasons why I wrote the article on blockchain in healthcare from a data-centric perspective is because what excites me about blockchain as it applies to healthcare is all about data. So I think I refer to the universal personal identity. It goes beyond the personal health record. It goes beyond your digital identity, whether it's legal, what your legal status is, what your social identity is, what your professional identity, what your financial identity is. So you try to merge all of these different aspects of ourselves. These are dimensions of us. And so what excites me is the concept of data sovereignty, for us to be able to be true owners of our own digital health or digital identity or legal identity, if you will. Anything that really describes who we are in all the different dimensions. I think we've heard enough about Cambridge Analytica, for example. There are too many other players that are mining and making large business out of us. We are their products, essentially. And so what I think is exciting, that is truly transformative based on blockchain, is for us to be able to own our own identities, for us to be able to use technology as a means of obfuscating critical pieces of our own digital information that is sensitive, and selectively disclose that with authorized parties and be able to incentivize interaction with our data. So I think that's a real transformation, and I'm really excited to see us poised at the brink of that.
That's amazing. Hopefully that'll get us through the airports faster. Adam?
For me, if I want to use one single word, is liberty, empowerment of individuals. 1990s were the era that internet came, Windows came, everybody started learning, have access to all the information. But the problem is with the population health management, there is a minority of people who don't get what they're really looking for. And that is the problem with the population health system. We are moving towards personalization. Everything needs to be individual. And this is the time that blockchain is really for people who gives the healthcare to the individual. It's an action time. That was the learning period, now the action period is starting. That's what blockchain does.
Great answers. Let's say, move the clock maybe 5 years or 10 years from now. What do you think will be totally different in healthcare that is standard practice right now? Where do you think the big changes will happen?
Well, as I said earlier, I think we'll have trans-global health. I hope that the babies in the baby center will have trans-global health, where they can have access to any expert anywhere on the globe, where they're not locked into a single health system that is serving them. And that they'll have access, as I said earlier, to the health expressions of other cohorts around the globe in ways in which has been blocked from this generation.
Nice.
So I'll come back to the thing about data. For me, really, it's not to make it sound cold in any way, but I think data has the power to harness the best of us as individuals. It makes us able to share our information in a way that we can control the shareability of that data. This is one of the broken trust issues in healthcare, for example. If you think about why the EHR really hasn't worked all these many years that we've been working with EHRs, and yes, adoption has been there, but it hasn't served its true purpose and its true function, because the EHR was created to provide optimized healthcare. And what we've seen is that healthcare hasn't been optimized, and that's because trust and shareability were broken. And so when you think about data being shareable at a whole new level, because we are now finally going to be the arbiters of that information, and again, coming back to selective disclosure, are going to be able to share that data with authorized parties for selected use cases. That's when you can see the power coming together. So not only are you going to be able to see aggregate sets of data like Adam was talking about in population health, and be able to look at underserved populations, at-risk populations, all of those forgotten segments, if you will, and look at providing true health care to those segments of the population, but then take all of those aggregate insights and then provide it at a personalized level as well. And I think that's really where we're headed to, is personalization or individualization of healthcare.
Yeah, I think a lot of patients will have, I think all patients will have control over their own health data, and I think the communication between a patient and a doctor will be far more efficient I think the timing between having doctors update your record or trying to obtain your records will be significantly lower, causing a far more efficient system. I think that a lot of these health systems will attach coins or cryptocurrency with this process of adding data or medical records to a patient, or for a doctor to add that. They will be incentivized in this process. I think that cycling will enable a lot of patients to receive incentives and for doctors to receive incentives as well, for health systems to receive incentives. So I think that cost will be significantly lower in 5 years, perhaps just by implementing the concept of blockchain.
Cool.
Well, you mentioned it's $1 million question. It's hard. I look at the healthcare today as like a jungle, beautiful. You are inside, you see the world, trees and wildlife. Everybody has developed excellent products, and they are all for good reason, on a good faith. My problem is that they are not coordinated. They are not interoperable, not just technically, socially, politically, everything all together. I see healthcare needs to go through a harmonization. That's what we like in Regimet 360. Our concept is to create a symphonic orchestra. Right? We provide the venues, tools, and a conductor who coordinates all the stakeholders. The players are the stakeholders, doctors, pharmacists, or everybody in healthcare, and the audience are the patients. That's what it has to be like. How long it's going to take to get there, we don't know. It's all with blockchain, as I said, it's going to be a political, social issue. It's not just technology that we are worried about. There are people that are going to undermine it. We're going to see it. So I agree with all the rest of the panel. I agree they're excellent. We are going to get there. But when we are going to get there, that is the issue. And I hope that will happen very early.
Thank you. My last question for the panel before I open up to the audience. Give us a piece of advice for an entrepreneur sitting here and thinking, what can I do in blockchain?
So I'll start again. Well, my first piece of advice, and it's not mine, somebody else used it already or provided this, was if you would like to get into this area and haven't spent significant time here already, block everything out of your life for 48 hours and have a stack of papers, have a stack of YouTubes that all your colleagues have recommended to you, and then use that 48 hours. It will be transformative. But it's not something that you can do a half an hour here and an email there and something else. You want to be an entrepreneur in this space, try to find 48 hours.
So I'll second that with the 48 hours. Actually, my colleague and I are partnered with a few other people to run a hackathon during the Blockchain Economic Forum coming up in June. We're both speaking at the conference, and we're running a hackathon inviting large players such as IBM, and we're talking to some other people like JP Morgan's Quorum, for example, to invite them to showcase the different platforms that can be developed on, and then create a community of developers that can use those platforms to explore concepts that need problem solve, basically, and use that time during the hackathon to create prototypes to try to solve these problems. I think, ultimately we come down to education, and I think, and I second what Brigitte said, which was, spend some time learning about this technology because it's truly transformative. And there are many different ways that you can arrive at this information. As an entrepreneur, I would say look at the problems that exist out there. Find something that excites you and really captures your imagination and saying, this is a problem that means something to me. Because to me, entrepreneurship is about passion and purpose. And I think if you combine passion and purpose and look at something that really excites you and say, I really want to try to find a solution to this, and I want to see how blockchain can potentially be applied to facilitate that solution, to me that's a great place to start.
Thank you.
Yeah, I absolutely agree. I think that there are many people that are looking to get into blockchain just because it's such a buzzword. There are people who have some general idea that they want to get into blockchain, and they may be in healthcare or a different industry, but they want to be somehow tied with blockchain. So I would suggest, and sort of very specifically saying that probably start with writing a few use cases, and use cases are a step-by-step process of what you see yourself doing in blockchain. So if you have an idea in blockchain, write a use case, collect your requirements, and really figure out what exactly is the solution that you are trying to solve in all of this. I think that it takes a lot of time to sort of figure out what sort of data do I actually put on the blockchain, how do I actually do this, where do I start? There are many people who decide that going crypto first before creating a blockchain is a solution, or creating a blockchain demo first before the crypto is a solution. So really define your goals up front. If you want to get into blockchain without really knowing what blockchain is, writing a use case again, defining your requirements and defining your goals up front is key.
Thank you.
Well, for me, it's like you have to look at it from a functionality and making a difference. I would like to, when you think about how you want to solve a problem, and if you start from an individual level, you will find a way to use the blockchain. That's easier. But if you use a traditional way, you want to make the money quick and create a corporation, probably you will not get too far, because this is not what it is. In the short run, you rather go to the central ones, maybe you make more money, right? But this is about movement. It is about liberty of the whole information, entitlement of what you have as an individual. And if you stick to that ideology, probably, most likely you will be very successful.
Thank you. I'll open the panel up for questions, so let's see.
Hey, thank you for your contributions tonight. I'm Henning from CryptoWork, and I would like to know your opinion. What will be the use case we will have his first breakthrough in healthcare?
I see a lot of enterprise sorts of applications as being the low-hanging fruit. You might have heard of virtual clinical trials. I think this is something that we are moving towards, because again, it comes back to data. If you're able to gather, aggregate data over large population sets, the future we can bridge to that future of ultimately, for example, conducting a virtual clinical trial using that data across multiple global sets of population. So that's an area that I see that is accessible to us. The other that is almost immediate is supply chain and pharmaceuticals. So you've heard of counterfeit drugs, for example. This is a problem that is prevalent in many of the poorest countries around the world, actually. An enormous amount of drugs that are counterfeit and that are leading to high mortality rates. And so if you think about eliminating that fraud or that counterfeit circumstance through blockchain, because it has high degree of traceability. I mean, it's basically an audit trail of where that drug was manufactured and every single transaction, how it passed through hands to arrive at the pharmacy, for example, and into the person's hands. You're talking about a full degree of transparency in that process, and so supply chain in pharma is a huge application to eliminate some of the problems we have in that area. So these are some low-hanging fruit areas, I think, that we're moving towards those much more rapidly than, say, personal health record and the universal personal identity, which is a great concept, but I don't know how achievable it is in the near-term time frame.
Yeah, and you asked which would be first. Now, I think first, but not transformative, of course, is the fact that we're working with a ledger on steroids. And so payment in healthcare is going to port to the blockchain pretty quickly, but that won't have transformed healthcare. It'll just make us a way more efficient, way less costly way of paying for the healthcare in the system that we have currently. So I think in terms of answering your question first, it's probably going to be our payment systems.
Yeah, I'd probably go with payment systems as well, but I want to also add to that and say that I think that there's certain sets of data that needs to be reconciled before any of these areas of blockchain can be explored. So things like a unique identifier is so extremely critical. It causes problems with interoperability between different systems. So how will the blockchain even communicate with the EMR? To even define that, it usually goes off of a unique patient identifier, and can that unique patient identifier be used in the blockchain as well, and can the two communicate? So I think that the first breakthrough in healthcare will truly be at fundamental elements, such as just being able to build that platform to accept data for a patient will be key to add to a ledger. And also just to kind of add to what you're saying with pharmaceuticals, I think the opioid crisis is extremely important today, and there is quite a push for the opioid crisis. And I think that there are many who are trying to find maybe perhaps blockchain as a solution. Although it doesn't solve the entire crisis, it does provide some level of solution for it. And so I think that a crisis may be an actual breakthrough to open up sort of the floodgates for blockchain.
My name is Mihir Parikh. I work for an Indian law firm in Palo Alto. We do a lot of research into emerging technology to look at what are the legal implications of that. I did a PhD in artificial intelligence almost 20 years back. And at that time, there was a problem. There wasn't sufficient data, and there wasn't sufficient computing power. Same issues we see today with blockchain. There are two major problems. One is resource consumption. If you consider bitcoins as the biggest application of blockchain, it is less than 0.111% of the world transactions, and it is using as much electric power as the country of New Zealand, right? So if you think about when we convert all of this into blockchain, the amount of propagation, amount of power consumption it will take, do you think we'll have sufficient capacity to do that? One. And second is the latency issue. It takes several hours for Bitcoin transaction to get authenticated. Now, if you are in healthcare, emergency care, and if it takes several hours for your patient record to get authenticated, will it really work? What is your take on it, and how do you see it as the future?
I'm glad you asked that question, because it actually is the investment thesis for our fund. We're really a big proponent right now in enterprise, and if you think about any hospital provider as an enterprise, of private and permission chains. So what does permission chain mean? It means that you're working with trusted nodes in the network, and so you're able to sacrifice ultra-high security for greater trust between the nodes, and therefore the shareability and the movement, transaction speeds go way up, and the cost depends on the protocol. So you're talking about Bitcoin, that's proof of work. Proof of work is very consumptive. If you go to proof of stake and other models, that's much less consumptive in terms of energy. So those are great questions, and I do believe that in healthcare, what we're seeing is permission chains that are based on proof of stake models and not proof of work models.
Absolutely. These are problems that have been identified since the inception of the Bitcoin blockchain. And so we have some serious expertise working on them, and as just mentioned, some solutions right in production already. Proof of stake, permissioned blockchains. I think the problems that we're talking about here are being solved as we speak.
Yes, so on the computing issue, I find that very interesting that you bring that up, because mining is a very expensive operation. I know there are some mining companies that have solar panels that try to cut the costs, and I tried mining myself, got the machine, and received almost $1,000 electricity bill that same month. So it's quite costly. I know they are trying to do it in other countries. There are certain solutions that they are trying to work on with mining as well to try and improve that process alone, and I think it will take some time. I think blockchain is still very young, and it's only 12 years old perhaps, and so there's a lot that needs to be improved on the mining end. Actually, believe it or not, Satoshi, the founder, the sort of the enigma in all of this. He didn't really address mining, and a lot of people bring that up, that why didn't he address the computing problem? Wouldn't he have brought that, have a solution for that? And he actually didn't. So that's one thing people are trying to work on. And with the latency issue, I agree. I think there's a proof of stake and a proof of authority as well, which is another one. And I believe Bitcoin is proof of authority right now. And that process alone causes a certain limitation on the size of each block in Bitcoin. And because of that, it can make the transactions process way slower. And so Bitcoin specifically limits the size of their blockchain. And so it's really, would you rather have something that has a small block with small transactions, or something that can carry larger blocks? And so I think that's an ongoing debate. And again, once we get to the level of being able to scale a lot of this data, we'll be able to understand whether proof of work, proof of authority, proof of stake, whichever one it would be, that would be most efficient at that time.
I'll add to that, and just in closing that thought, is that a lot of it is trade-offs, right? I mean, if you think about the internet was this open communication platform. Security really wasn't the focus. If you look at what the focus of blockchain is, it's really ultra-high security. And so, if a hospital or any other provider wants to use blockchain technology, they may have to use other models like the permission chains to compromise on the security, saying, well, we're working with trusted entities, so we can sacrifice some of that ultra-high security, but we want higher transaction speeds, and that's what we're seeing. So it's always a trade-off, and again, you have to ask yourself, why are you implementing blockchain technology? What problems are you trying to solve? Start with that why, and then think back about and reverse engineer the process and saying, okay, what do I need for this, and what kind of implementation is going to be best to solve the problem that I'm trying to solve.
Just that last bit about, I love that word, trade-off. Everything's in that word. Galen Moore from New Alchemies, he said it best. He talked about the Bitcoin blockchain. He called it like a cockroach. You can't kill the thing. The more you try, the stronger it gets. And so lots of trade-off with the Bitcoin blockchain, but it's an incredibly resilient and secure situation that's been going on now for almost, 10 years.
Thank you very much for the entire discussion so far. I have a little contrarian view to the discussion that is going on. We are proposing and solidly supporting the fact that, yes, it's going to solve the data interoperability problem. However, if every institution has their own blockchain because they want to keep the data for the patient to their system securely, then essentially it's creating more data silos. Right now we have data silos because each hospital has its own mainframe systems and cloud and whatnot, and then they don't share. And it's the same problem that will occur if we have multiple blockchains. So my question here is that what really is blockchain solving that we cannot really solve with the current technology having the right intent to solve the problem?
So, great question. First of all, it could become a problem, but what I have to point out is that a lot of companies right now are working on the cross-chain problem, and this is solving the problem of sharing between blockchains, okay? So this is something that we know many of the startups are trying to work on as cross-chain solutions, basically, to allow for interoperability between the blockchains. The second point is that why blockchain? Because the current system is so damn insecure, right? I mean, it's already been proven time and time and time again that centralized systems are exactly that, central points of failure. And the minute you are able to hack into that central repository, you've got keys to the entire kingdom of whatever data resides on that. So there's every flaw in that centralized system. And so the only way to truly protect that data with the high level of security that we do need in healthcare, for example, is to move to a decentralized model that's in blockchain.
I don't know what...
But security is in the fact that you cannot change the data, but getting access
No,
to the
no,
data.
security means that you can't get access to the data at all. It's all through the system of private keys. And so that private key is not something that, you know, anybody's going to get access to. The other thing is that because decentralization means that you don't have that data all residing in one location, even if somebody were able theoretically to get access to that point, they can't get access to the entire record. It's only that one little part of it. So it's almost like saying, here's the big elephant, I got a hold of the tail, but does that mean that I have the whole elephant? I don't, right? I only see the tail. And so this obfuscation of the data, basically, and not having it all reside in one central location makes it very, very powerful in terms of implementation through blockchain.
One last question before we close.
Yes, since we're sort of a group of entrepreneurs and investors interested in healthcare, can you name 3 startups using blockchain for healthcare that are profitable at this point?
Blockchain is pretty young right now. There are companies that are existing companies now applying blockchain technology to what they're already using. So we are seeing that, and they're not profitable. I think this is new technology. This is new breaking ground. Think of 1996, 1997 .com era in terms of where we are in this cycle. We haven't hit the true potential yet. However, in terms of startups in the healthcare space, there's some pretty exciting companies that are out there working on the data issue, for example. There are companies that we just saw at Consensus. We were just there at Consensus. There was this big conference in New York. There were about at least 10,000 people in that conference, all blockchain enthusiasts. The crazy energy out there in terms of for blockchain. But I think, you know, there are companies like Doc.ai, for example, that I mentioned. That's an AI company that is also solving the issue of data as well across omics and applying AI into that. Another company that we found out about was, gosh, now I'm going to blank out. We just met with them. Huh?
China?
Pardon?
China?
Yeah, there's companies from China actually that we've been talking about, genomics companies that are doing something pretty extraordinary, combining genomics, AI, blockchain, and ML. So you're talking about really pretty powerful deep tech in combination with AI, in combination with blockchain to solve, again, the problem of data. A lot of the things that I get excited about is data, because I think those are fundamental things. And the unique identifier that Zenith was talking about, that's something that I'm just kind of dreaming about, saying we have to arrive at this. So there are many companies that are working on those specific problems.
Just one word, though. You used the word profitable, but the big thing that's happened is for the first time, startups are raising multiple of millions of dollars at the outset of their projects. This is very exciting, and hopefully we'll figure out how to make that happen smoothly with our own regulatory system. But we don't have, profitability is becoming a word that has more meanings now with the different types of funding models.
Well, I'll touch on profitability as well. If you look at early internet days, nobody was thinking about profitability, right? If you looked at any investor in the Valley and talked about profitability, it was almost anathema, because a lot of the investors here in Silicon Valley look for hyper growth, right? We look for scalable models. That's what we do here in Silicon Valley. If you look at Europe, for example, or some other parts of the world, many other parts of the world, profitability is a really big thing. A lot of companies are, almost driven towards profitability right away through their investors, their board members, or whomever. All the different stakeholders with that company are all encouraging that company to move to profitability. We're right now in a nascent stage of technology, huge potential in healthcare. We're not thinking about profitability just yet. And then with the potential to raise inordinately high sums of money through ICOs, maybe not necessarily in the same way here in the US, but in other jurisdictions, the possibilities are really enormous to be able to provide that runway that a startup needs to be able to execute on the plans that they have.
Yeah, I want to add, as an investor, perhaps you may be looking at, is it really is it funding that you are raising through an ICO, or is it considered revenue? And you have to take a look at whether the actual blockchain product is in beta phase or test phase, and if there's an actual cycling of the tokens already happening, you can kind of consider it as revenue through an ICO. However, if you have a blockchain company that has just put out maybe a demo and doesn't really have that yet, and they have a concept, a white paper, and a really nice website, it's going to be funding. So I think that just sort of based on that, and 3 companies that would consider that sort of profitability in that definition would be Healtherium, Universal Medical Chain, MediChain. There are many health comics. They have raised a great amount of, it could be either revenue or funding.
One thing that I wanted to make it, this is, Brigitte touched on this as well, the regulatory landscape here in the US has shifted so dramatically since February that we are not able to raise that kind of money based on a white paper anymore. So the SEC regulations are basically forcing us into having actual product at mainnet. So there's testnet and mainnet, right? Mainnet is when you actually have your token distribution event, that you actually have products. So from an investor's perspective, that's actually pretty good. So you're looking at not necessarily profitability, but you're actually looking at a project that has an actual product. They're deploying that product. It's kind of like having a robust MVP that you're going out to market with. And actually, that's not such a bad thing from an investor's perspective. So I just wanted to add that, you know, what we saw last year in terms of being able to raise really high sums of money based on a white paper and a marketing website and a marketing campaign, that's just not possible here in the US. It is possible in some of the other jurisdictions, which is why we see a lot of companies being registered in other jurisdictions. Ultimately, you as an investor here in the US, whether you can participate in that ICO will depend on whether that company is open to receiving investment from US investors and complying with US regulations.
On that note, we will thank the panelists